Good morning or good evening, Docpreneur Nation. My name is Michael Tatro. You're listening to and watching the Docpreneur Leadership Podcast, and we have a special guest, and we're going to be talking about prostate cancer and prostate cancer testing today with Dr. Phranq Tamburri. Dr. Tamburri, thank you for being here. And by the way, he has the most unique spelling of his first name that I've ever seen with a PH. So Dr. Tamburri, thank you for being with us today to talk to doctors about a really important topic, prostate cancer, and what you and Exosome and the DX test there is doing. We'll put the show notes and links below, but tell us a little bit about Dr. Tamburri.
Well, again, my name, I have a Philadelphia Italian hippie parents that wound up tweaking my names. That's the reason it's spelled that way. My background, I'll give off a little bit. I'll try to do this quick, but I think it plays into where and how my practice is and how I come from more of an integrative approach. I went to, I have a conventional background and an alternative background, so a little bit bilingual that way. I started off driving ambulances and paramedic work. Later on, I worked at Merck Pharmaceuticals, conducting phase 4 drug trials. So I know the drug companies, both bad and good. They have some good parties too, but I understand the drug companies. After that, I was head of a surgical team for tissue banking, tissue harvesting. They would fly us around back east where I got this accent, and we would remove femurs for bone implants and dermatome skin for burn victims, hearts for valves, that sort of thing. So I got to play surgeon for a while, and doing so, you get to know also how the sausage is made. And for you doctors out there, why many of you are probably in concierge medicine, you kind of understand why, both how medicine works and the medical system. So in any case, I decided against becoming a conventional physician. I was going to be an ophthalmologist at the time. And I decided to fall back on my international economics background, and I followed international policy in Japan. I graduated from Kansai Gaitaku outside of Kyoto, Japan. I lived at a Buddhist monastery for some time, hence why I still have the ponytail to this day from all those years ago. Spent time in Mongolia, China, other places, came back to America, a bit confused. I had many different interests trying to figure out where to go. And I discovered naturopathy. Now, I didn't discover it like many people do. There was a little bit in a different sense. I appreciated what natural medicine could bring, and also not being so reliant on a medical system that I thought was broken. That was back in 1990 something, and that I knew in time would continue that direction. So that's why I decided against conventional medical school, came out here to Arizona, where we have one of the greatest scopes of practice out there around the country for naturopathic doctors. So here we're considered full integrative or PCPs. We can prescribe medications, conduct forms of minor surgery. My own practice, I conduct color Doppler transrectal ultrasounds of the prostate, something that I could not do in my home state of Pennsylvania, for instance. So anyway, I came here. I eventually became resident and then chief resident of the medical school here at Southwest College Naturopathic Medicine. And the chief residency was a unique situation. I don't even think they still have the chief residency now. Residencies, just so you guys know, in naturopathic schools are paid for by the school. Conventional residencies are paid for by Medicare dollars if you're an M.D. or D.O. Naturopaths, we don't get Medicare dollars. We're considered quacks by most of the country. So 24 states, I think we're like 25 now, we're licensed in. So therefore, the schools pay for it themselves. I did help create the first men's health program at Southwest College. And then following that, kind of putting together these two worlds I mentioned, and this kind of plays into our discussion later, is I became the first naturopath to do rounds with Mayo surgeons or Mayo trained surgeons in urology in this case. So because I spoke the language of MDs coming from that background I mentioned earlier, I could speak their language and learn from them. And as I tell my medical students, I've been professor of urology for about 21 years now. That's the advanced urology class. I tell them, people call us alternative. I don't think I'm alternative. We're really integrative. But as I tell them, you can't really be a good alternative practitioner unless you understand what you're the alternative to. And that's why I think having a foot in both worlds is very helpful, because as we'll see pretty soon, when it comes to prostate cancer, most of our guys are caught in that quandary, and probably many other topics that you take on also. But prostate cancer is exceptionally so. If you have a skin cancer or something on your skin, you just point to where it is, and there it is, and do a quick biopsy. Either it's cancer or it's not. And cancer is usually a bad problem. We usually determine cancer late staging, so it's usually an emergency. But prostate cancer is one of the only cancers that we have so many screening tools. We have the PSA, right? Reflex when I do the finger, as you can see. But we have the PSA test, prostatic specific antigen, which is kind of one of the themes today. And that test, has problems, but at least we have a test. There is no PSA test for pancreatic cancer or brain cancer. We also have the DRE, the old finger exam, right? And as I tell my students, I can't put my finger up someone's behind far enough to palpate their brain if they have brain cancer. But we have two tests, a physical DRE and a PSA test that combined at least let us know in advance, if there's a prostate cancer problem or there's something to see.
So before we jump into
go ahead.
into the meat and potatoes of the content in a minute here, talk to us about how you went from, the specialty that you're studying in into prostate cancer, and what led to that personal interest in that. Usually it's sometimes it's a family business, or sometimes it was a personal story. What really kind of led you down that route to study this and make this your passion?
Well, it was probably a couple reasons. One was that, it's funny, I never wanted to go into cancer because I didn't feel like dealing with all the liability problems. I just thought that was too much of a minefield. One reason was I had a girlfriend that had a urinary problem, and I got fairly good friends and with one of these Mayo trained urologists. I also saw that urology was part of the body of the reproductive system that I found fascinating, because from a naturopathic perspective, that's one of the areas where the body's redundant. We have 2 lungs, 2 kidneys, 2 testicles, 2 ovaries. I know the lungs are not part of the urinary tract, but my point is there's a redundancy of the system. And, to be very crass about maybe evolution, as Richard Dawkins, back when he just focused on evolutionary medicine, used to talk about that human beings are nothing but walking extensions of our gonads. In other words, we just exist long enough to get the DNA to the next generation. And once it's passed on, it doesn't matter what happens to you from an evolutionary standpoint. And so it's the focus of biology is all about the reproductive system and the urinary tract, or the urinary area, which is reproductive when you study it. So I found that fascinating. It seemed like the core of life, and seeing the redundancies and the tenacity that biology or Mother Nature has. The fact you can have a vasectomy, not to get off topic, but a vasectomy, and you cut the cord, the vas, and if you don't implant and anchor one of those vas deferens into the scrotal wall, then, as Jeff Goldblum once famously said, Jurassic Park, life will find a way, and each of the vas will anastomose together, and that person's called a father again, like a couple of years later. So I just found the tenacity of life very fascinating. So that's one reason I went into it. Also, from a personality perspective, my grandparents raised me. So I'm used to being around older people and the older generation, and that there's a lot to that, understanding my patient demographic and who these people are. Many of them are business owners. Many of them are affluent. Many of them both, because, like many of us probably in this audience, concierge medicine, we tend to, have many of those clients. So I understood that generation. I understood that they came from a world of Marcus Welby, and half of you guys hopefully know who that TV guy from the 70s, the old doctor shows. They thought that to them, that's medicine. This new medical system, many of these older patients, they're like, well, where's Dr. Wellsby now? This is not what they signed up for. And when they have a prostate cancer problem, they're looking for help, but they're confronted with a medical system that doesn't respond to them. So that's something I was aware of. And lastly, not to get too much on this topic, but I also understood the economy was going to be a problem and the government takeover of medicine. And I knew that at the end of the day, it was seniors, it was going to be the older generation that would still be independent enough and have the money to be able to pay as a concierge doctor for this type of medicine. Whereas if I focused on 25-year-old young people, they may not, long term. So there were a number of reasons why.
So part one, this is a two-part series for those physicians listening. We're talking with Dr. Tamburri. He's with the team at Exosome, and we'll put it's ExoSomedx.com. We're going to put that link in the show notes as well. But our guest today is Dr. Tamburri, and we're going to be talking with him about some of the challenges in this part one of introductory challenges of prostate cancer and importance of early detection. Many physicians understand the process of that, but really our discussion today is focused around the utility of a urine gene expression assay for early detection of prostate cancer. We're going to really do an early dive into it here in part one, but then a deep dive into part two. The team over there at ExoDx has really shared some unique data and evidence and reports on this, and we'll put the links to that in the show notes as well. And you can contact exosomedx.com directly if you're a physician listening.